Dr. Chloe Costigan here from Mobility Doc. Check out these 3 different hip internal rotation mobility exercises that you're probably not doing. These are a really great way to make sure that you have all of the range of motion that you need for something like running. If you're feeling frustrated with hamstring and glute pain, try these hip internal rotation exercises because this might be just what you're missing. When we talk about internal rotation, what we mean is that the femur is going to be turning in toward midline. This is a rotational motion. So my whole leg is coming this way. It might be helpful to think about it in terms of your foot. Your foot is turning in. Where this starts to get confusing though is once your knee is bent. So I like to think about it coming from where the joint is actually moving. So this is the femur is turning in. Now, the first hip mobility exercise we're going to do for internal rotation is simply seated internal rotation while keeping this leg straight. So I'm going to be in this long sit, that's what we call this. And so I'm going to bring this right leg out to the side. I don't need this right now. And I'm just going to be thinking about turning this femur in. Now this might seem really simple, especially if you have suitable range of motion. But the thing though that I'm trying to do is I'm trying to keep this thigh bone down as I turn this in. What happens is if you're limited in range, you're just going to want to move that ankle. Try not to do that. You're going to try to stay in one line, and then this whole femur is turning in toward midline, and I'm coming back to center. In toward midline, coming back to center. The other thing that I'm focusing on is making sure that I'm trying to sit as upright as I can. So you might need to kind of push yourself forward to give yourself assistance because you don't want to be in this rounded position, okay? We want to focus on trying to strengthen in a functional position. So I'm going to do 10 repetitions of turning this leg in. I'm pausing for a second and then coming back to midline. Pausing for a second, coming back to midline. And really think about how am I moving? Am I initiating the movement by turning this thigh in? I'm trying to also make sure that I'm not hiking that hip up either. And now do both sides. So for me, it's much easier and I have much less resistance turning in on this right side. I'm trying to use this right side to teach my left side, oh hey, here's how you should move. The progression to make this a little bit harder is if you bring this leg out to the side and now you try to turn that leg in. So the more abducted I am, the harder it's going to be to try to turn this leg in. And I really can barely move. This would be the progression. So for me, I'm okay with staying here to start because this already feels pretty restricted. I can actually even feel it kind of like cramping up along the side here, like where my TFL is and where my glute attaches, my glute med attaches. Now, the second exercise is this same motion, but now we're going to do it in prone. We're going to do it on our stomachs, okay? So I'm starting here, and now hip internal rotation can get a little bit more confusing because now if we were using our foot as the gauge, this is confusing because now hip internal rotation is this motion. So you see how my foot's coming out to the side, and that's because the top of my thigh is turning in. So I'm going to do 10 repetitions where I'm turning this leg in and my foot is going out. So now what's going to make this a little bit harder is now my hip is extended and now I'm trying to internally rotate. So I'm trying to think about getting to that end range of motion without compensating by flexing my hip. Some common compensations is that we're start to rotate too much. My right side is lifting and my pelvis is going with it. I'm trying to push my pelvis down as I turn. Side view is like this. I'm trying to keep this front part of my pelvis down and I'm turning. So I'm just coming out to the side and then I'm coming back to neutral. What will happen sometimes is people will just start rotating like this. What I really want you to try to do is to just get that internal rotation, then back to neutral. Internal rotation, back to neutral. You're going to do 3 sets of 10 of these. I'm also trying to make sure that my ankle isn't moving at all. So what will happen sometimes is the ankle will start to do some different things to try to assist. I'm just trying to keep my ankle in one position. The progression is that you're going to bring your leg out into abduction. So now I'm moving it away from midline. Then I'll bend that knee, and now I'm going to try to do that same thing, that internal rotation. Now I can really feel that this hip is going to try to like lift up, I'm going to still try to press that down and pause. Press that down and then come back to neutral. Okay, after doing some active range of motion to find that internal rotation, now we're going to stretch in that position. So we are going to do my variation of the Brettzel 2.0 stretch. This is going to be a little bit different though than what you typically find for the Brettzel 2.0, so make sure to watch this. I'm going to show two different progressions as well. We're going to stretch the front of the hip in internally rotated position. So if I'm going to stretch this left side, I'm going to bring my right outer thigh down, then my left inner thigh is going to come down. I'm intentionally making sure that I'm not bringing this leg way out to the side. So I'm going to bend this knee a little bit more, and I'm tucking my toes under and I'm pointing my toes down. Okay, so I'm going to try to extend this hip. So now this leg is in internal rotation. So you see that it's like, this is just what we did when we were on our stomach, where this leg is out to this side slightly, and now this thigh is turning in. Then I'm going to extend my hip and then come down on my elbow. So this whole time, what I'm also trying to think about doing is that same internal rotation that we had been doing. So I'm trying to turn this thigh in as I keep this hip extended by squeezing my glute, okay? I'm going to hold this for 30 seconds and do this 3 times. If this doesn't really feel like this is doing very much, what you can do is you can start to transition. So you're lying on your back. And then I like to place this right foot down, because then I can lift my hips up and try to make sure that both sides of my pelvis are pointing up. Then I'm going to squeeze my glute and press this knee down. So now you see this hip is really internally rotated. But what I'm going to try to make sure that I do to make this internal rotation even more challenging is that now my pelvis needs to be level to the ceiling. Okay, so my pelvis is going to start to rotate over to the right as well. But I'm going to try to rotate my pelvis to the left as I try to turn my thigh in. So they're going now in opposite directions. It's like I'm trying to almost lift up this right side of my pelvis as I turn that left inner thigh in. And then I'm pressing that knee down, squeezing that glute, and now I'm really stretching in this internally rotated position. I like to start with the active range of motion exercises first. When you do this seated hip internal rotation, it's going to give you an opportunity for your brain to start to learn this motion. This isn't something that we are regularly stretching or moving into, so it will be really helpful to make sure that you're isolating that range of motion, because that isolation is key for improving that flexibility, and it will also be key for when we start to strengthen in that internal rotation position. So start with the seated hip internal rotation, then you're going to move into the prone hip internal rotation. You're going to do 3 sets of 10 of each of those. Then finally, that's when I like to do my version of the Brettzel 2.0, because now we're stretching in that hip internal rotation range of motion. Sometimes for myself, because I've been doing these for a little while now, I'll start with the Brettzel 2.0 in that lying down position, in that supine position, because I've worked on that range of motion a little bit, and now it's going to make it easier for me when I do the active range of motion. The most important thing though is to do these with consistency. So this won't take you long, and it makes a huge difference. I actually do this hip internal rotation before I run, and it's actually made a huge difference for me for not feeling that high hamstring and glute pain. More than doing any foam rolling through my glute, more than doing figure 4 and pigeon and hamstring stretches. Now, of course, those are important for addressing this high hamstring pain. But the thing though is that what we also need to do is we need to teach the thigh what position it should be in. So we work on loosening all of that up. Now we need to teach it, okay, here's how you can be in midline, even though you're used to being in that more externally rotated position. Stay tuned, because once you master this hip internal rotation mobility, then we can move on to stability and strength. I have some really cool things that are going to be helpful for improving that hip internal rotation strength. It's going to make those adductors stronger as well, and it's going to help to continue to alleviate any of that high hamstring and glute pain. Give this a try for 2 to 3 weeks and let me know what you think. It has made such a huge difference for me. It's made a really big difference for my patients, and I'm really excited to hear your feedback. Join me next time as we start to focus on hip internal rotation strength. But remember, you need the mobility before you start to improve the stability and strength, so don't skip this step.